Bismillahirrahmanirrahim. Assalamu alaikum everyone. This is Dr. Sundar Mehtab Shafi. And this video is just an introductory video regarding the guidance for MRCP PACES and how to ace it in first attempt. So, first of all, I want to mention that start preparing yourself um, with some timeline mentioned in your head. Along with this, you should know what is inside the exam. Because if you don't know what is inside, you can't prepare yourself beforehand. So first of all, you should know what's the pattern of the exam and what are the changes being made from the previous pattern. So first of all, I'm just going to revise and give you a brief review regarding the basic pattern of this exam. And then in the later videos, I'll be dealing with more regarding the exam format, and will give you the tips and tricks about how to ace this exam in first attempt. So let's move on to the first slide, and it is regarding the carousel. Now, you need to understand this carousel very much and in a very good manner so that you can focus on the different skills that that are going to be assessed by the examiners during the exam. I always say that all these exams are just the game of nerves, and I mean it, because it's not just about the exam of your knowledge, but it's about the exam of your skills. And it's not only assessing you, it's not only assessing your knowledge, but it's assessing you and your skills as well. So everything counts. For example, your body language, your confidence, your way of speaking, and of course, your knowledge and your clinical skills. So let's move on to the carousel first. You can see that there are, if you can see my cursor, there are 5 major stations that you need to deal with, right? And 3 stations are subdivided into 2, and 2 stations are complete stations that you need to be in there for next 20 minutes. So each station comprises of 20 minutes, and in between the stations there is 5-minute interval for case reading. Now let's move from the station 1. If for example your first station 1, then you will face 2 examiners that will first deal with the communication station, and the same pair of examiners will assess you for the respiratory examination. In communication station, they will give you 10 minutes, and there will be scenario given before this is station 1. Like in this 5-minute interval, you will be given a scenario that you need to read, and you'll be given a paper and a pencil. You can write it down, the important points that you want to mention in the communication skills. And after that, you'll be facing a surrogate, and with whom you will be communicating, and 2 examiners on station 1 will be assessing you. Those examiners will remain quiet throughout. They will only assess your acting skills or your communication skills. They will not going to ask anything regarding your communication skills, and they are not going to interrupt you. After 10 minutes, they will ask you to move to the respiratory station. Now, on the respiratory station, they will give you a command that examine the respiratory system of this patient. Usually, there is no scenario, but they can give you a clue. For example, they can say that this patient is having complaint of shortness of breath, or patient is having complaint of cough. Please examine the respiratory system. Now, you can break this 10-minute period for 5 to 6 minutes for your examination, and then the next 4 minutes for the viva. So importantly, try to complete your examination within 5 minutes so that you can face the viva in a proper way. After this station, you will be in the resting phase for next 5 minutes, and this is the 5-minute interval for reading the scenario for next station. And then next station is the station 2, which is of consultation. So the scenario will be given in the interval period. You need to read the scenario and note down the important stuff. Then you will go to the station 2. Again, you will face two of the examiners and you will be allowed to take history and do relevant examination of the patient for next 15 minutes. And in this 15-minute period, you need to address the concerns of the patient as well. So after 15 minutes, for the next 5 minutes, you will be facing examiners for viva questions. After that, again, there'll be 5-minute interval. And in this interval, again, you will be facing you will be you in this period you will not be facing any sort of scenario, and you will be free to relax, to have a sip of water and to sit down, because in after this interval you will be facing station 3, in which there are two subdivisions. First, a pair of examiner will ask you to examine the cardiovascular system of the patient for 5 minutes or 6 minutes. And then for the next 4 to 5 minutes, they will ask you relevant questions in the form of viva. After that, they will ask you to move to the next patient, and the same pair of examiners will evaluate you for the neurology station in the same way. After this third station, again, you will sit down and read the scenario for the next communication station. And in this station 4, you will face the communication station first, and again, nobody will interrupt you during the communication station, and you need to perform solely with the surrogate. After 10 minutes, the examiner will ask you to move to the abdominal examination, and during the abdominal examination, they will ask you to examine the abdomen, and then they will take the relevant viva. After the station 4, they will ask you to move to the interval station, and again, you will be facing a scenario. You need to read it carefully, write it down, and then again, you will move towards the station 5, which is again the consultation station. And that will be just a repetition of the pattern that we follow in station 2. And after station 5, you will be free. I hope you like this video. And in the next video, I'll be sharing more of my knowledge with you. Thank you so much. Take care and Allah Hafiz.